Hey everybody, good afternoon. Thanks for joining us. We're going to wait here just a minute while we've got some folks logging in. Nice to have all of you with us today. I wish we were all in the same room together, but unfortunately that is not the case. But we still want to do our best to bring this to you. So we'll give it just a couple seconds here. Got several people joining. So I'll get started here in just a minute, folks. I'm just seeing the number of participants continuing to bump up. Looks like we've got about 12,500 people on the call. No, I'm kidding. It's going to be huge. I just wanted to welcome all of you. Good afternoon and welcome to the 2020 Georgia HFMA Virtual Fall Payer Forum. My name is Bill Ickes and I will be your moderator this week for the forums. We appreciate all of you joining us. I trust that you're all well and doing your best to manage through this challenging time, and boy, what a challenging time it has been. Certainly my preference is to always meet in person, but times like this have forced us to think a little bit differently. We know that the payer forums are worthwhile and valuable for you, and Georgia HFMA has a long time commitment of cooperative and collaborative communication with the payers. And so we wanted to do whatever we could to keep the lines of communication open and continue to host these worthwhile events. So here we are. Each day this week, we will have a different payer presenting for about an hour. I would ask that if you have any questions for the presenters, just to submit those through the Q&A section at the bottom of your screen. Please be sure to do not include any PHI in those questions. But first up today is Palmetto GBA. Joining us from Palmetto GBA will be Sandra Booker and Marlene Frierson, both provider education consultants with Palmetto GBA. Vinsetta Montgomery sends her regards. She was called into jury duty last week and wouldn't you know, got selected. So she's got a busy couple weeks, I think, ahead of her. So she'll be busy with that. Palmetto GBA will be hosting their Mactoberfest coming up next week on the 20th and the 21st. They will mention a little bit more about that during their presentation, but you can also go to their website for any additional details. Charles Kanan is also participating on the call to help to answer any questions that might come up today. So welcome to all of you and thank you for attending. The presentations this week will be posted to the Georgia chapter website in the In Case You Missed It section. Those should all be out there by hopefully later this week or early next. Again, the lineup for this week is Cigna on Tuesday, United Healthcare on Wednesday, DXC Medicaid on Thursday, and Ambetter on Friday. Now I'll turn it over to Marlene Frierson with Palmetto GBA. Thanks so much, everyone.
Thank you. My name is Marlene Frierson. I'm with Palmetto GBA, as Bill just indicated, and we're going to get started with you. I am substituting for Vinsetta, but we're here to give you the information that they've put together so that you guys can get some tips here for today. So what we're going to do, I'm going to get started, and for the agenda, we're going to first discuss Medicare secondary payer conditional payments. I have some COVID-19 updates, and then we want to give you the information for the new influenza season. We were going to provide some reminders and tips regarding these items for you and help you get going with these new initiatives, well, updated initiatives, to make it a little easier for you. For the Medicare secondary payer, I'm going to start off with just not the entire program, but just regarding some tips for conditional payments, which occurs when a provider submits a claim to Medicare on the condition that the payment is going to be returned to Medicare, but for services for which another payer is responsible. It's just to help the beneficiary not have to come out of pocket with that, but there are some things you need to know. Next slide. Under certain circumstances, Medicare may make conditional payments subject to reimbursement if the workers' compensation, no fault, or liability insurer has not paid or will not pay promptly, and that's that 120-day promptly pay period. So what are conditions of payment? Well, for conditional payment to be made, there is involvement from liability insurance, no fault insurance, or workers' comp. When there is no involvement from them, there is not already an open file as of the date of service, so no open group health plan, GHP, on the common working file, MSP auxiliary file, which is the repository of files that stores that information as of the date of service. There is an indication that the claim was filed with the primary insurer first. Palmetto GBA wants information from the primary payer's explanation of benefits, so you need to be sure to include that. And the biller has not received payment during the promptly period, which is that 120-day period. Next slide. If the insurer has not paid or will not pay promptly, there are certain conditions for you. And those conditions are, I'm sorry, my laptop is being a little slow here today. Okay, the main thing that you need to know is that when they're looking for the file information, all that information is kept on file by the Benefits Coordination and Recovery Center, the BCRC, and they are the sole authority to ensure the accuracy and integrity of the MSP information contained in CMS's database. That is information that is stored in the common working file. And if there are any updates to that, that is who you should contact. And they are responsible for gathering, as I stated, that information and providing any investigations if necessary when it comes to Medicare secondary payments. Next slide. Their responsibility is that they consolidate the activities that support the collection, management, and reporting of other insurance coverage of Medicare beneficiaries. All MSP claims investigations are initiated from and researched at the BCRC contractor. They provide customer service to all callers from any source. When should you contact them? Whenever you have a potential MSP situation, there's an invalid MSP auxiliary file, or you just have a general MSP question or concern when it comes to, again, Medicare secondary payer. And the main thing is that they are the main ones, well, they are the sole authority that controls that information in those files. So anytime you need that information updated, that is who you would contact. There are times when they will have the beneficiary contact them, but the providers can initiate an investigation if needed or let them know that a record needs to be updated. Next slide. The role of the MAC, the Medicare Administrative Contractor, is that we process claims submitted for primary or secondary payment, accept the returns, inappropriate payments, and answer questions regarding claim or service denials and adjustments. Answer questions on how to bill for payment, submit claims. Just please note that the PCC, the Provider Contact Center, will not tell you how to code your claims. That's something that we cannot do based on some rules and regulations with CMS, but we will assist after you've got the claim submitted. It's returned, rejected, or et cetera, to try to point you in the right direction on getting that claim submitted correctly. And then we also, as a MAC, handle claims-related recovery questions. So those are the differences when it comes to the BCRC and the regular MAC duties. Next slide. Additionally, you can call the provider contact center regarding claims-related and recovery questions, and that number is there for you on the slide, which is 877-567-7271. You can also use the Medicare Secondary Payer Inquiry Form for any MSP request pertaining to primary or secondary payment of claims. However, be sure to follow the helpful hints on our webpage, such as, just as an example, you would only use the form if Medicare should have paid as secondary to a primary insurance. Do not use the form for new claim submissions, and you would not use the form for situations that involve the Veterans Administration, the VA, and you would use a reopening form instead whenever you're talking about the VA. So there are certain circumstances where you would not use that form, but again, those tips and helpful hints are on our webpage. The BCRC Customer Call Center, that number is listed there for you, which is 855-798-2627. You can also find their contact information and address on the CMS website. Next slide. And just getting back, we all know that the conditional payment is just that. It's conditional. It means that Medicare is paying the provider on the condition that the provider will reimburse Medicare once the case has been resolved. Also, do not file for a conditional payment without filing to the primary payer first. That's very important. I mentioned the word promptly a couple of times. The Medicare definition of promptly is 120 days after receipt. So if the primary insurer has not paid within 120 days of you submitting the claim, then you can submit the claim to Medicare for a conditional payment. Now, there is a situation that has occurred that I need to bring to your attention. Unfortunately, there have been reports where providers have denied services to Medicare beneficiaries because of an open MSP record found on the Common Working File, CWF. Some providers have refused to see or admit patients for this reason. Please note, providers cannot deny services based on the status of the patient MSP record, okay? So Vinsetta has that in there, and I want to make sure I emphasize that you cannot refuse to see or admit patients for that reason. Next slide. Now for the MSP conditional payment, one of the questions is, after 120 days, the promptly period, if no response is received from an automobile insurance, can we bill Medicare for the conditional primary payment? And the answer is yes. But remember, conditional payments are made subject to repayment to Medicare when the primary plan makes a payment. Medicare may make a conditional payment even though the payment is expected to be paid by another payer. You should refer to the MedLearns Matters article, MM7355, and the link is there for you, for information on conditional payments and promptly situations. You can also view the Palmetto GBA website, where we have plenty of resources, and there's a specific article on conditional payment and helpful hints in there to tell you how you should submit those claims. So we will refer you to those as well. Next question, if the other payer never pays, then is provider allowed to keep the conditional payment? And the answer to that is, to make the Medicare Trust Fund whole, the BCRC will work with the primary insurer if the primary insurer is responsible for the charges. Payments made by Medicare as a conditional payment, providing that you file the claim initially with the primary insurer and they fail to pay timely can be maintained during this process. Next slide. So let's have a quick knowledge check. The provider is required to keep MSP records for how many years? All right. The provider must reimburse Medicare within blank days of receiving payment from the primary insurance.
I'm going to say seven. I'm going to say 7 years, same as my taxes, and I'm going to say 60 days.
Okay, Bill. Well, let's see if it's correct.
Ooh.
All right, next slide. You almost were there.
Almost.
I like that 7 year. I like that rationale, but it's 10 years. So providers are required to keep MSP records for 10 years. And you're right on the second one. The provider must reimburse Medicare within 60 days of receiving payment from the primary insurance. Good job.
Yeah, 50%.
We'll curve it a little bit.
There you go.
All right. All right. As you see there, some of your MSP resources, you are encouraged to use the MSP resources available on the Palmetto GBA website. I mentioned the article that's specific to conditional payment because that's the portion we were discussing, but here also is a Medicare secondary payer coding module, which provides a quick reference to the most common common condition, occurrence, value, patient relationship codes, remark fields, primary payer codes associated with Medicare secondary payer MSP claims. So this is a fairly new tool, and it has good information for you in one place as to what the codes are when you're filing those claims for Medicare secondary payer. Next slide. Also, for some resources listed on the next couple of slides are some common resources that come in handy when you're trying to locate MSP related materials. So there for you is a link to the Medicare secondary payer manual, the internet only manual with CMS. You have the MSP questionnaire. You have the CMS MSP fact sheet, clarification of the Medicare conditional payment and billing procedures, the article I was speaking of. Bill is showing you there on that next slide, the MSP basic modules, the MSP e-services tab, the MSP coding module, which I just showed you on the previous slides, and MSP overpayment. And then you also have just an MSP section where we have references to guidelines, policy, and other MSP articles. So we hope you'll take advantage of those materials that are out there for you. Next slide.
Yes, the ever popular COVID-19 updates. I'm sure we got some questions maybe about this.
Okay, so I'm going to go over some general updates on the COVID-19 public health emergency. The updates are going to include some recent eligibility changes for the 20% discharge incentive, general guidelines and status of the delays and extension, and a couple of FAQs that Vinsetta thought would be helpful to you. And with that, CMS provided clarification on the 20% DRG incentive that applies to COVID-19 discharge patients. The next few slides will clarify the policy on the discharge guidelines, as well as how to decline the discharge incentive. Section 3710 of the CARES Act provided the direction to increase the DRG weighting factor by 20% for an individual diagnosed with COVID-19 that are discharged during the COVID-19 period. Next slide. There is information and guidance regarding the DRG 20% increase, which is found in the MedLearns Matters MLN, which is right there on that slide for you. SE20015. What's not listed, but will be listed as a resource whenever we send the slides for Bill to post. You will find another Mid-Learners Matter article, which is MM11764, which is dated April 24, 2020. And that one is titled Quarterly Update to the Inpatient Prospective Payment System, the IPPS, Fiscal Year 2020 Pricer. And it's a PDF that will be for as a resource for you as well. Okay. Next slide. These MLNs identify the diagnosis codes that are applicable during the specific time frames. So between January 27, 2020 and March 31, 2020, using code B as in boy 97.29, the other coronavirus as the cause of diseases classified elsewhere, for discharges occurring on or after January 27, 2020, and on or before March 31, 2020. So that's what you would use. From April 1, 2020 to the present, you would use code U07.1, which is COVID-19, for discharges occurring on or after April 1, 2020, through the duration of the COVID-19 public health emergency period. Next slide. Providers should follow and understand the specific coding guidance provided by CMS regarding the COVID-19 discharges. This slide has the link for the coding guidance for discharges on or after April 1, 2020. So this information will be very helpful for you as far as how to code. Next slide. The following change was communicated in MLN SE20015 to address potential Medicare program integrity risk effective with admissions occurring on or after September 1, 2020. Claims eligible for the 20% increase in the MSDRG weighting factor will also be required to have a positive COVID-19 laboratory test documented in the patient's medical record. So the important thing is you have to have a positive COVID-19 laboratory test documented in the patient's medical record. And that was effective for any claim on or after September 1, 2020 for the eligible 20% increase weighting factor. Okay, next slide. The positive lab test requirements. Positive tests must be demonstrated using only the results of viral testing, that is molecular or antigen, consistent with the CDC guidelines. The test may be performed either during the hospital admission or prior to the hospital admission. Next slide. For this purpose, a viral test performed within 14 days of the hospital admission, including a test performed by an entity other than the hospital, can be manually entered into the patient's medical record to satisfy this document requirement. For example, a copy of a positive COVID-19 test result that was obtained a week before admission from a local government run testing center can be added to the patient's medical record. In the rare circumstance where a viral test was performed more than 14 days prior to the hospital admission, CMS will consider whether there are complex medical factors in addition to that test result for purposes of this documentation requirement. There may be a reason that a provider will need to decline the 20% DRG incentive on a COVID-19 discharge claim because there is no evidence of a positive test result. If that is the case, at the time of claim submission, enter a billing note, NTE02, no positive test, on the electronic claim. Next slide. Please be alerted. CMS may conduct post payment medical review to confirm the presence of a positive COVID-19 laboratory test, and if no such test is contained in the medical record, the additional payment resulting from the 20% increase in the MSDRG relative weight will be recouped. So just want to bring that to your attention. Next slide.
Hey,
Now
Marlene, before you continue, let me just remind people, if you have questions for Marlene or for Sandra or for Charles today, please start submitting those questions through the Q&A section at the bottom of your screen, and we'll be sure to get them as many of those questions as we can during our time today. Thank you.
Yes. Okay. Now we're going to go over a few of the COVID-19 delays and extensions. All right, next slide. First, I'm going to touch on the accelerated advance payment. And let me say here, Bill and I discussed this before we got started today. There's going to be our presentation, but CMS just released some changes to this, and it was done after we had already submitted the slides, so this is truly hot off the presses. But I'm going to go over in my talking points, but the updated information will be submitted to you guys in a PDF, so you'll have that information as well and how to refer to it. But basically, the purpose of the accelerated payment is to increase cash flow to providers of services and suppliers impacted by the 2019 novel coronavirus, COVID-19 pandemic, when there is a disruption in claim submission and or claims processing. Now, the updated information is they recently enacted Continuing Appropriations Act 2021 and Other Extensions Act, which amended the repayment terms for the expanded accelerated and advanced payment program. No action is necessary from the providers. This repayment process will begin automatically. So with the accelerated advanced payment, Palmetto GBA is going to issue letters to any provider or facility that received an accelerated or advanced payment with full details regarding repayment of their accelerated or advanced payment. If a provider received accelerated or advanced payment in multiple disbursements, each disbursement amount will be listed along with the corresponding date that repayment for each disbursement will begin. The letter is going to include a list of your accelerated or advanced payments, including the amount, the dates that the repayment will begin. The related accounts receivable, AR numbers, will also be included in the letter. Now, this is also changed, and it's not on your slide, but will be submitted for you as an attachment. Repayment terms. Repayment will begin 1 year after the date the accelerated payment or advanced payment was issued. During the first 11 months after repayment begins, repayment will occur through an automatic recoupment of 25% of Medicare payments otherwise owed to the provider. During the succeeding 6 months, repayment will occur through an automatic recoupment of 50% of Medicare payments otherwise owed to the provider. If a provider is unable to repay the total amount of the advanced or accelerated payment through recoupment within 29 months, the provider will receive a demand letter requiring repayment of any outstanding balance, subject to an interest rate of 4%. Okay, and that's recent. It just came out. I think it was Friday. And again, this was after the slides had been submitted. So the repayment terms have been changed, and how the repayment is going to occur has been changed. Next slide. Now, this is an image of the remittance advice, and it provides a visual of where you need to look for where the accelerated payment is going to display on that remittance advice. So if you see that red block, that's where that payment is going to show for you on your remittance advice. So you just want to provide an example of that. cost reports had delayed or extended due dates due to COVID-19. This chart shows all the extensions that CMS has approved thus far. So, for example, for the period ending December 31, 2019, it would have been initially due on May 31, 2020, but the due date was extended initially to July 31, 2020, and then they went back and revised it, and it was due for August 31, 2020. Okay, next slide. Now we're going to go over just a couple of FAQs. I'm sure there are quite a few, but here are some of them for you. Just a couple that we thought would be important. Where can I find the specific waiver information? And that's going to be found in that link there, but it's under emergency-related policies and procedures that may be implemented without Section 1135 waivers. This document contains a long list of waivers, some of which that address hospital services as well as billing rules. Okay, so you can find it there at that link, which is on CMS.gov website. Also, COVID-19 emergency declaration blanket waivers for healthcare providers. That is also, the link is being provided there for you, and that's also on the CMS.gov website. Next slide. Do providers have to submit a request to CMS to implement each waiver or the waivers automatically in place? And CMS can issue two types of waivers: blanket waivers and provider/supplier requested waivers. The blanket waivers may be used without notifying CMS. And those blanket waivers, we have a link there for you. And then the individual waivers that you submit a request for, those have to be approved. And a link is there to provide information on that as well. And I would also like to say that for your COVID-19 resources, next slide, Bill, you can please continue to obtain the most up-to-date information from the CMS website and sign up for their COVID-19 listserv. And not only is it just on CMS.gov, but Palmetto GBA, under your Jurisdiction J Part A website, we have a COVID-19 section as well. And there are COVID-19 updates there for you. By signing up for our listserv, you will continue to receive our updates as well. And here's a screenshot that shows where the COVID-19 information can be found on the Palmetto GBA website for your Jurisdiction J. Once you enter the COVID-19 section, you can get information on the following topics, which are the emergency disaster instructions, an overview, general information and updates, the MLN updates, healthcare facilities, all health professional guidance, and other various articles can be found there. Now we're going to touch on some reminders for you about flu vaccines for Part A providers.
Should we give everybody a chance to wash their hands or maybe take a squirt of sanitizer since we finished the COVID-19 part? There you go.
We probably should.
Yeah. Very good.
All right. With the influenza vaccine, the flu vaccine, basically, frequency, Medicare generally covers one flu shot per flu season. Additional flu shots may be covered if it's medically necessary. As far as coverage, Medicare beneficiaries pay nothing for the flu shot. There is no coinsurance and no deductible, right? This is a chart of the Part A facility types that bill the influenza vaccine on the UB04. So here are your type of bills for the flu vaccine. Next slide. General roster billing is a way for providers to submit multiple claims for flu or pneumonia, PPV vaccines. CMS defines mass immunizer in the following manner. Offers flu and or pneumococcal pneumonia vaccination to a large number of people. May be a traditional Medicare provider or supplier, such as a hospital outpatient department or non-traditional provider like supermarkets, senior homes, or public health clinics. Submit claims for immunization on roster bills. And for institutional claims, providers must vaccinate at least 5 beneficiaries per day to roster bill. This requirement does not apply to inpatient hospitals that mass immunize and use the roster billing method. For roster billing for mass immunizers, the requirements are you be licensed properly in the state where you operate, be enrolled in Medicare, accept assignment on the shots and their administration. You have to bill the Medicare Administrative Contractor, Palmetto GBA, bill only flu and pneumonia shots and administration using this process. For your direct data entry, DDE, roster billing is a quick and convenient way to bill for flu and pneumonia vaccinations. To submit a bill through the roster bill entry option, you must have given the same type of vaccination to 5 or more people on the same data service. Each type of vaccination must be billed on a separate roster bill. You cannot have pneumonia and flu shots on the same roster bill. If you administered a vaccine to fewer than 5 Medicare beneficiaries on the same day, you must submit the claims individually on the claims and attachments entry menu. Only 1 data service per roster page and a maximum of 10 beneficiary patients per roster page may be reported on a DDE roster page. Please utilize, next slide. Please utilize the direct data entry user guide located on the Palmetto GBA website. Specific information can be found in section 4, claims and attachments, 4, D as in David, roster bill entry. The DDE entry begins with the claim and attachments entry screen. As a reminder, if you use the user guide that I just provided to you, it'll help you as far as entering this information and knowing how, what you need to enter for your different types. So there she has for you in red how you would enter that information and press enter. And she has it showing down at the bottom where you would enter that 87. Next slide. For additional resources, there's CMS has for you coverage coding and billing for all Medicare preventive services, an immunizations link, which is in the Medicare Benefit Policy Manual. That's Chapter 15, Section 50.4.4.2. Your CDC, Center for Disease Control and Prevention, Influenza. So there, she listed that website as well, vaccines.gov, and also on the CMS website. And then we also have for you a fact sheet on mass immunizers and roster billing and Medicare billing form CMS 1450 and 837 institutional booklet. So I know you're probably tired of hearing me speak. Now you get the chance to hear Miss Sandra. Sandra Booker.
You did a great job, Marlene. Thank you so much.
You're welcome.
Thanks, Marlene. Bill, before we get started, can you elevate Charles to the panel to be a panelist because he couldn't get in as a panelist?
Let me see if I can do that. I don't want to slow us down too much here. If he could always submit a response if he had to through Q&A.
Okay.
But I just, yeah, let's keep going. I don't want to slow things down. I'm not completely well versed at the administrative side of this yet, so I don't want to mess things up.
Okay, great.
My apologies, Charles.
Again, my name is Sandra Booker, and I am the education consultant for JJ Part A. And I'll be going over medical review on targeted probe and educate, or TPE, outpatient department prior authorization, or OPD PA, and just to give you some Palmetto GBA and CMS resources. Next slide, please. Medical review and targeted probe and educate, or TPE. You can go to the next slide. CMS has instructed all MACs that effective August 17th of 2020, they may resume Medicare fee-for-service, or FFS, medical review activities related to the improper payment rate, limiting their focus to post-payment reviews for items or services. And at this time, targeted probe and educate, or TPE activities, we don't have definite dates on when that will start. So right now they're only doing post-payment reviews for services that were done or that were provided before March 1st of 2020. Next slide, Bill. These are the post-payment active medical review. So if you receive an ADR for each claim that's selected, which will be outlined specific to the service and collected for free. You will be tagged with Palmetto GBA with preventing improper Medicare payments, and this is accomplished by education, training, and medical review of claims. So these are the reviews that medical review is doing. Your DRG 885 for psychosis, the drugs and biologicals, they're listed individually. Also, the therapeutic exercises and manual, as well as the hyperbaric oxygen therapy, or HBO. The required documentation for psychosis should include the physician orders. You must provide a valid certification and recertification, as well as submit a completed psych eval, initial psych eval, as well as a completed treatment plan. And your history, your initial psych eval with the medical history and physical, 24 hours of admission, in case greater than 60 hours after, in order to establish medical necessity for psychiatric inpatient hospitalization services. And also your treatment plan. That's very important because we see a lot of claims that get denied because the treatment plan is incomplete. So make sure that you have your treatment plan completed with the diagnosis, the goals, and everything else on it, as well as your progress notes and other progress notes that to support your medical necessity. Next slide. These are some of the common denials that are being seen for drugs and biologicals. Services not documented, the protocol is not followed, units billed or more than ordered, there may be some billing errors. Also, dependent services denied for qualifying services denied medically and technically. So to prevent increased errors for these denials, include all of your documentation that's related to the services billed for the dates of service, making sure that it's for the correct beneficiary, as well as the specific service dates that are billed. Your physician orders with dose frequency, the route, as well as the date and time of the associated drug. Also making sure that you have the documentation that's relevant to why the patient is receiving the drugs with the history and physical and any progress notes. Next slide, please. Common denial seen for hyperbaric oxygen therapy, or HBO. The protocol was not ordered and or followed. there was no documentation of medical necessity. Again, we see the dependent services were denied for medically. Units before more than ordered cases were not documented. So again, making sure that you have all of your relevant documentation to support medical necessity. While the patient is receiving this, the treatment, making sure that you're including any type of clinical signs and symptoms, history and physical and progress note that can also help with your medical necessity. Next slide, please. Required documentation for 97110, which is therapeutic exercises, and 97140, the manual therapy. The evaluation and the plan of care always include that, your certification, certifications, any type of documentation to support the medical necessity the patient is receiving, the therapeutic exercises for manual care. Your progress notes also include if there's any changes, making sure you document that in your progress notes or your in your team meetings that that should be going on to help support medical necessity. You can also find this information in the Medicare Benefit Manual, publication 100-02, section 220.3. Also making sure that your orders are signed as well as your plan of care. That's very important as well. You can go on to the next slide, Bill. And right now we're going to get into the prior authorization for outpatient department prior authorization. Next slide. And July 1st, CMS implemented that the 5 services that are listed now require outpatient prior authorizations for blepharoplasty, Botox injections, paniculectomies, rhinoplasties, and vein ablations. And this is for only if you have a bill type of 13X that you have to have prior authorization for. Next slide, Bill. Again, this is for services that were on or after July 1st. CMS implemented this starting July 1st. And the hospital outpatient department providers must submit the PA to your MAC, which will be Palmetto GBA, and we would review the information submitted and issue a decision for affirmative or non-affirmative to the provider. And the provider must submit a request for an expedited, or they may submit a request for an expedited review of a PA if the delays in a regular PA decision could jeopardize the life or health of the beneficiary.
Sandra, I think we had a question about a section that you could, if you could repeat. Can you please repeat the manual and section for therapy 97-110 and 97-140? I think you broke up a little bit. Is that, and that's why they couldn't hear you? Let me try to back up to that.
Okay. That section is the CMS Publication Manual 100-02, Chapter 15, Section 220.3.
Okay, I think I have that slide up. And just a reminder too that the presentations will be posted on the chapter website here shortly. So let me make sure that got answered. Yep, looks like we're okay on that. All right. Remind me where I was, right here or next one? 56 or 50?
Okay.
Where?
1 second. I was typing in that for because it wasn't listed on the slide. Whoever asked the question about the section.
Yeah.
Okay.
So am I back at 56 or 57?
I think you're at 50, right there, 56.
Okay. Okay.
Okay. So the PA must be submitted before the services is provided to the beneficiary, before it's submitted for processing. If you submit the claim and had not submitted a PA and you have not received an affirmation decision, an affirmed decision, your claim will be denied. So just make sure that you submit your PA for the 5 services that were listed if you're providing these services in a hospital outpatient department. And this is just to make sure that the documentation that you're submitting meets the Medicare coverage, coding, and payment rules. Next slide, Bill. When submitting your initial documentation, you should make sure that you include the hospital patient department information as well as the beneficiary's information. If you just so happen to receive a non-affirmed decision, you cannot appeal that. That is not appealable, but you can resubmit your PA until you receive an affirmation, an affirmative decision. So just remember, if you submit a prior authorization and it is non-affirmed, you cannot appeal it. You have to resubmit the PA and submit the documentation that that's missing or that's been requested for you to submit it. But you can resubmit a non-affirmed decision as many times as you need to. Next, please. You also have to submit the requester information, the physician that's requested this information or the person that's sending the information in, and also make sure that you include the telephone number as well as the fax number. And the same thing with the hospital information. Make sure that you include a hospital fax number as well as your physician or practitioner information, the MPI and the PTAN. You can go to the next slide.
Sandra, just a question about that. Are you moving away from the fax communication? I know some organizations are paying close attention, obviously, to data security and protecting PHI and whatnot. Are you moving away from that where that maybe won't be required as much in the future or will perhaps be discouraged?
Well, as always, we always try to encourage providers, if they have not signed up for e-services, to sign up for e-services. That way, because it's the most efficient and fastest way, and it is secure, where you can submit documentation.
Okay.
As well as the PA. So if you have not signed up for e-services, signed up for e-services, and that's like the fastest way that you can get your information sent in and back to you. Because also if you're submitting the PA information, you will receive, if you're signed up for e-services, you will receive something in your inbox in e-services as well.
Okay. Thank you.
You're welcome. And also in your submission, initial submission documentation, include codes, the diagnosis code, submission date, if it's your initial or subsequent review. And also if it's expedited, and if you have to do an expedited PA, you have to also include a reason why it's to be expedited. Again, your PA is Palmetto GBA for review and for decision. Palmetto GBA will complete a review of the medical records and send the initial decision letter to the postmarked or fax. Usually it's sent back fax or by e-services and by the way that you send it in. And also, as I just mentioned, you'll be able to receive your decision letter in your e-services portal inbox. This slide, the next slide, please. This slide is an example of VA request for Botox injections. If you're given Botox injections, there are only certain J codes that require a PA, and they're listed on this slide on the request form, and the request form is also listed on our website as well. Next slide. If you're sending in your PA, you can fax it in, you can mail it, you can send it by ESMD as well as e-services. And the fax number that's listed, that goes straight to the PA department. If you're faxing it in, and if you're mailing it in, the address is listed there: Palmetto GBA, Part A, Prior Authorization, P.O. Box 100212, Columbia, South Carolina 29202. And again, if you fax it in, you will receive it back fax. You send it through e-services. You get a letter, your decision letter through e-services. And if it's mailed, then you'll receive it back through mail. But we are strongly encouraging everybody to send everything through e-services and or faxing. Okay, next we'll go over some Palmetto GBA resources.
Hey, Sandra, Charles added a comment. He said that Palmetto GBA is in the process of changing the filters in e-services so you can search by MBI or patient name. We're also working on filtering the message function by type of letter, he says.
Right. If you didn't hear that, we are changing the filters in e-services so providers can search by the MBI number or the patient's name. And we're also working on filtering the message function by the type of letter. So hopefully that'll be coming out soon with that. And on this screen we have JJA website. On the page, you see I have some red arrows pointing. You have the outpatient prior authorization status tool where you can check the status of your prior authorization. Also, we have the outpatient department prior authorization tab. You can go there, and we have a calculator there. We also have checklists for each service that now requires a PA. You can look at that checklist and utilize that for your staff to make sure that you have everything that you need, because some of the services, they do require color photos to be submitted. And also there's an arrow by the Medtoberfest, which Bill mentioned earlier. So if you haven't signed up for Medtoberfest, you can go there, click on it, and sign up for whatever sessions that you would like to sign up for. And we'll also be going over OPD. If you're interested in OPD, we do have an OPD session, and it'll be a little bit more in depth because it'll just be about OPD. Next slide, Bill. Also, if you're wanting to see what's going on with medical review, you can go to topics, which is circled at the top, and you can click on medical review, or you can click on general medical review, and it'll tell you everything that's going on with medical review, the active medical reviews that they're doing, TPE, and so forth. And also there are other great things that are on our website that you can utilize as well. Next slide, Bill. Again, I believe Marlene mentioned the PCC, or the Provider Contact Center, earlier. That is your first point of contact, and their hours are from 8 a.m. to 6 p.m. at the number listed, Monday through Friday. And also we have an interactive voice response, or IVR, that's available 24 hours a day, 7 days a week, except for our dark days. So you can utilize that. Also for social media, you can follow us on Twitter, LinkedIn. We also have some YouTube video and out there, Facebook, and also listserv. If you're not signed up for the listserv, please sign up for the listserv because if anything comes out new on the website or if there are any updates, you will be notified of that. So the listserv is very helpful, and it's also tells you about our events if there's something coming out that you may be interested in.
I think you should get Vinsetta to open up a TikTok account for Palmetto GBA and do some stuff for us on TikTok.
Oh, goodness. I think a lot of people would have fun with that, but I don't know if we can do that.
Yeah, I don't know. We'll leave it up to her. Maybe she's got one. We don't know. We don't know. Yeah. All right.
Yeah. So,
that about wraps it up, huh?
Yeah, and I was trying to, because I knew the time was limited. But are there any other questions before we end our session?
Yeah, I just had someone ask about the presentations in general because we have some folks from outside of the Georgia chapter. So the at the Georgia chapter website, georgiahfma.org, there's a section called under media. There's a section called In Case You Missed It, and we're going to have a folder set up out there for the 2020 Fall Payer Forum, and we'll have the different presentations under that. So. Yeah, but other than that, I'm not, we'll give some folks just a second here to submit any additional questions that they might have. But as of right now, that seems to be it.
Yeah, okay. Well, it's, again, as Bill stated earlier, we're usually in person, and I hate that we can't be in person this year, but it seems to have all worked out. And
yeah, we'll do it again. Hopefully get back together maybe in the spring or something for a spring forum. But I really appreciate you and Marlene and Charles participating today. You guys have always been very supportive of Georgia HFMA and our payer forums. So thank you for that very thorough presentation, and best of luck with your Mactoberfest next week. I'm sure that will be well received. And I don't know that we have, I don't know that we have any other questions. Marlene, did you have any closing comments? Anything else you wanted to add?
No, we're just happy to participate with you guys. And of course, if you need anything, Sandra just provided that information, the first point of contact, PCC. But if you need anything additional from us, and I'm going to get that additional information in a PDF format to you for those resources that we discussed about the changes with accelerated payment, Bill.
Yeah, that's great. That's great. I don't see any other questions coming in, so let me just give the folks a quick heads up. Tomorrow we have Cigna at 1 o'clock Eastern Time. Cigna is going to have both their Medicare managed care representative as well as their commercial representative participating, so we'll cover both sides of the coin there. We've got United Healthcare on Wednesday, we've got DXC Medicaid on Thursday, and we've got Ambetter on Friday. So appreciate everybody's participation, and thank you so much for your time today. Everybody take care and stay well.
You too, thanks.
Have a good one.